it's the biggest event in their life at that moment, and we do recognize that. And repetition doesn't make us become more immune to that problem. We recognize that this to them in this moment is their greatest fear, is that they have cancer, that they're going to die, they're going to leave their family behind. That's our biggest strength, is we understand where they're coming from. And in breast care, it's always that heightened sense of emotion. And so for me, I use a combination of knowledge, humor, and realism, and being a real person to sort of reel them in to recognition that we're going to take care of this. We're a team, we're going to get through this together, and we're going to get to the other side of this problem, and you're going to go back to a normal life, because that's my plan for you, and that's what your plan is, and I know that we can get you there. And I think that that sense of every time I meet somebody, a new patient, knowing that we can get them through this problem, one way or the other, is that strength that I can sort of infuse into them. Because they come in a level of fear, and I'd like them to walk out in a level of, oh, God, okay, I can handle this now. Well, it's a team of the patient and I mean, that's the first team, you know, and the patient and who she brings in. And I always say, okay, if you bring in 2 people, I can bring in 2 people, all right? You know, we've got to have equal sides to our team, but they come in with their loved ones, and I have a team that includes, in the University Surgical Associates, our multidisciplinary coordinator for our breast cancers. We have assistants, we have PAs, we have nurse practitioners, we have 3 surgeons, and we in the University Surgical Associates alone are a team that is dedicated to getting you through this problem. But in addition to that, particularly for our breast cancer patients, we have a multidisciplinary cancer team that we have spearheaded a project 2 years ago where the patient's first meeting with for our breast cancer patients is in a setting where they'll meet the surgeon, ourselves, and the medical oncologist, the radiation oncologist. They'll meet with geneticists potentially. They'll have a tumor board meeting for them, and then we will discuss all of the points that were brought out in the tumor board so that we have an organized team approach to their next step. So their primary therapy, whether it's surgery or chemotherapy, is going to be aligned right in that first meeting. It helps the patient feel that it's a concerted effort where everybody's working toward their cure. All of these people are there to help them every step of the way. And if there's questions, there's phone numbers they can call at any time. So I think that that's our team. And it's a large team, but it's a very connected team. And so the patient feels like part of a family. And I've often told people that, you know, we're married now, that this is it, we're a family. This is a long-term relationship, and get used to it, because we're here to stay. That needs to come through, that we really know where we're going and we know what we're doing, and we've got a lot of nuances of, well, you know what, in this situation we've got 2 new trials, and if you go in this direction we can initiate that trial. And I think that part needs to come through for my patient before I start with the crazy analogies. And do I make people laugh? Yes, I do. I really try hard to kind of make them, ooh, okay. Take a deep breath, because it's such a scary thing and it's so emotional. And one of our medical oncologists, she said, I go into the room first and they're all crying. You go into a room first and they're all laughing when I come in. And I said, well, it's a subtle thing, you know, but first and foremost, you need to make sure that they know that you're going to get them through this. Your plan is to cure them. And if they can laugh along the way and feel good and feel that they know that we really care about them. I mean, we tell our patients we love them, because that's the girl in us. You know, when they go to sleep, I'm holding their hands and they say, Dr. Graves, I love you. And I said, I love you too, for getting you through this. It's very emotional.